The ASUM conference is just round the corner. It's in Brisbane this year, between the 1st and 3rd of November. Register and come and join us at the conference. I'm Ash Mukherjee. I'm an emergency physician and someone who's been interested in POCUS for the last 25 years. And I want to tell you what the ASUM conference has for you as a POCUS user. I attended the ASUM conference at Sydney last year, and I want to show you what I enjoyed during that conference and what you will hope to gain coming to these conferences or coming to Brisbane this year. As you can see here, this was a session on advanced echo where the attendees are learning some advanced techniques in echocardiography that's not necessarily commonly used in the emergency department.
And then you also are getting some 2D kind of analysis. You've got your built-in TAPSI. That's why it's built-in TAPSI. It gives you.
But it really makes a difference learning from the experts and to see what
function the contractility is. And when we are looking at walls, we're not looking for movement. We're looking for thickening.
If I actually asked you to measure
what the experts do and how they refine images.
What's called tissue Doppler. So it's exactly the same as ordinary Doppler, but it's focusing on the myocardium. So the rate, you notice the velocity range is much lower because muscle doesn't move that much, right?
And then, of course, there is the networking opportunities that you have during your breaks or after the conference or even in between lectures. This was a session on gastrointestinal ultrasound.
If there is hyperechoic weight underneath the rectum, even if you can't see the rectum well,
very good.
There's hyperechoic weight underneath,
workshops.
suggesting edema, and that there probably is some inflammation.
And to get an opportunity to learn about
to this tiny white line that's going across there, that's the serosal.
Scanning of the gastrointestinal tract.
We're talking 1.5 millimeters.
Is not something you will have opportunity to get at any other
you'll see a little bit better,
conference.
but we'll come back to that in a second.
This was the musculoskeletal workshop. 2 stations.
It's going to go big, and then it's going to get vascularity in it.
Again, a very interesting workshop, and for POCUS users in the future, it will definitely hold you in good stead.
Terribly lost with a median nerve. You've got a couple of options. Either find your radius just at the top. We're going to have our FCR, so this has a palmaris longus. So I'm now looking for my palmar cutaneous, should come off anywhere now.
This was a session where we learned a little bit more about scanning of pediatric hips.
So it's very easy to see that transition point. It's right there.
So you do it on the top of the dark bit, yeah? The echo gap.
Correct.
Okay.
Yeah, where the bone goes anatomic.
Yeah. It's just going to be on this lady. It's going to be like a layer of clinical.
Learning how to scan the groin for hernias. And even going through some cases, trying to establish the learning that we had through the workshop.
So first of all, tell me where we are, and please remember I've labelled it.
This was a session where we were shown how to do pediatric abdominal scanning. Again, 2 areas which can be of significant use for people using POCUS in the emergency medicine. And these were just a few sessions that I've been able to record, and there were so many more. Then, of course, you can't miss out on the gala dinner. Those of us who attended the gala dinner was at the Luna Park with a beautiful ambience. And then, of course, the gala dinner the awards being given out, the networking opportunities that we get to meet
everybody, thank you so much for
colleagues
being
from around
here.
the
I think the
country.
last 2 days have been a lot of fun. I think there's been great engagement in the rooms. Hopefully if you got to attend the workshops on Friday, you found the experience really valuable, just being able to get in there and scan and interact in a way that I think we haven't been able to do in the last few years thanks to COVID.
So think about registering. Go to the website, look at the program. There are lots of things that might be of interest to you. Register, come and join us. See you there.